Get started. So here are the questions we'll be asking and that we'd like to ask you to think about in this about not from your individual perspective. We know many of you are here in a personal capacity. Nevertheless, the questions are about your organization, and specifically, of course, you were invited if you were one of the 628 organizations that applied to join the collaborative. We're especially interested in your perspective. So look forward to engaging with you in 55 seconds. All right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and we're doing the second of a series of debriefs, really thinking together about the future of the collaborative. So this follows the General Assembly, which marked the end of the first peer learning exercise on the 6th of August 2024. Of course, we had this amazing intensive root cause analysis exercise. We'll be telling you about that, and today we're doing the debriefing. Now, we just finished a debrief for government staff, and here we're interested in all organizational partners. So you received an invitation, and really we're interested in today, how can your organization, so not so much you as an individual, but how can the organization that employs you, that you work for, that you are affiliated with, get the most from its participation in the collaborative? We're especially interested in this discussion because we know that we have civil society organizations, community-based organizations, and many others, but also the private sector. For example, a number of pharmacists organizations have joined this the collaborative. A quick reminder before we start: as you know, the collaborative is open to everyone who wants to make a difference for the children and families of Nigeria. We asked you if you face any of these challenges, and if you do, we especially want you to join. We asked you if you work with people really in difficult situations and fragile contexts, and especially encourage you to join the collaborative and encourage your organization to join the collaborative as well if that is the case. Now, for those of you who participated in the root cause analysis exercise, well, we are, as announced, we have completed a review of certification, and we will be announcing a commencement event during which we will award certificates to all those who have met these certification requirements for the first root cause analysis exercise. Now, to these consultations, we're inviting government departments and agencies. So we just completed this consultation. But of course, if you're affiliated with a government department, agency, or the Ministry of Health, you're welcome to share and contribute in this consultation as well. Civil society and community-based organizations, and then women leaders in the collaborative. And before I go any further, I really want to acknowledge the alumni ambassadors were key to actually initiating and jump-starting, let's say, this the collaborative all across Nigeria. This is a set of remarkable leaders, individuals in immunization who've participated in previous Geneva Learning Foundation global initiative, and we're very proud to see some of you here today. We also want to salute our guides on the side who accompanied the collaborative during the first root cause analysis exercise. Now, remember, we went working together. We really demonstrated the potential for large-scale digital peer learning to address local immunization challenges across Nigeria. And remember, this was countrywide engagement. Within 3 weeks, there were over 4,000 health professionals connected from all 36 states and more than 300 local government areas. Now, what was amazing about the collaborative. It was many things, but here are 3 of them. 38% women participants, almost 2 in 5 government workers, and then representation primarily from LGA and facility levels. Now, I know many of you know all this, but it's worth taking stock as we go into this consultation where we're going to be asking you questions about what should be the future of the collaborative. What difference can the collaborative make for your organization? So not so much for you as an individual, but really for your organization. And remember that very quickly, you saw that through the experiences that you shared, through the power of peer learning, there were experiences. Over 270 health workers shared experiences, shared accounts, offering insights into the realities of delivering immunization services. We asked you 2 questions. Can you tell us about a time when you tried a new or creative way to solve a problem? And question 2, why did you want to join the Nigeria Immunization Collaborative? Now, there was so much in terms of the quality and volume of experiences shared that very quickly we issued a second collection of experiences, again focusing on the local solutions that you found even before working in the collaborative. Then came the root cause analysis exercise itself. 410, more than 400 participants submitted draft root cause analyses. 278 participants submitted revised RCAs. And then going through the peer review process, 308 completed 3 peer reviews. That's 75% of those who submitted drafts, and 229 received 3 peer reviews on their work. Alongside the RCA and peer review process, you know that there were over 600 of you who participated in the first 2 days where you practiced conducting a root cause analysis on a local immunization challenge with real-world challenges and real-world colleagues who helped you and who helped each other. 60 of you, more than 60 of you, practiced facilitation skills as you decided to take up the role of the note taker and rapporteur for your groups. Again, this is a remarkable thing to have it happen in the context of a learning initiative that was all across Nigeria, bringing people together from all the states and realizing how much your challenges had in common. Now, looking at the insights were some of the things you told us. I'm just going to share 4. The first one is here. Issues seems to be simple, but they are interwoven. A solution requires multiple approaches. This is what a member of the collaborative took away from the activities. Another one said, challenges we face in our communities are not limited to us alone. Many face similar and even more challenging issues. Root causes often have systemic issues that need to be addressed in order to be solved. I learned how to do an RCA. I realized vaccine hesitancy is not the only reason for missed vaccination. These are all remarkable insights to have come out of a 2-week exercise that people did as you were working. You were continuing to do your daily work. And we saw, in fact, participants continuing to share and learn via Telegram, via self-organized Zoom calls, via LinkedIn, and so on. And 628 organizations formally applied to become members of the collaborative. It meant that there was someone who said, I am legally authorized to represent my organization, and my organization wants to become a member of the collaborative. A wide range of organizations, local government agencies, civil society organizations, pre-service training institutions, and then the second level was actually submitting a formal letter endorsing the collaborative, and you can see some examples of the letters we received here. Now, that high engagement was focused on some of the states that have the highest level of need, the highest numbers of zero-dose children, and the most fragile context, showing that the greatest level of interest in the collaborative came from some of these high engagement states. Now, before we open up for questions, because get ready, this is going to be, once again, about you and about your engagement and your thoughts, your thinking, and we're going to think together about where the collaborative might go next. Should we continue? Should the collaborative continue is the first question we're going to ask you. But if it is to continue, why? And what should we do next? You can see some potential areas for follow-up here, such as speeding and scaling compelling immunization ideas. Imagine the collaborative where somebody anywhere in Nigeria has a great idea for immunization, and it is spread. And people can say, okay, this is for me, this will work in my LGA, this will work in my state, or it won't, or we need to adapt it. But it can help to spread and scale ideas. Second would be to recognize and celebrate emerging new leaders. In a system where in order to do an RCA, you have to put in the hard work, and that is what makes you a leader. Third is to incorporate digital peer learning into existing processes. And these are ideas. You're going to tell us what you think of them, is if any one of these makes the collaborative attractive enough for you to continue the commitment that you initially declared and demonstrated. What can you imagine? There's this energized network of more than 4,000 Nigerian health professionals. You tell us whether you think that's a lot or little compared to the potential. But what can this energy do? How can this energy be used for the purpose of improving immunization outcomes and improving health? 5 is to widen engagement with the civil society groups. And 6 would be to document implementation and outcomes of selected ideas. The last point I'm going to make before we open up for questions is the level of engagement. Because each person in this room represents an organization. Again, you're not invited as an individual. You are invited today because you said, I am authorized by my organization to represent the organization in the collaborative, and that is what we're interested in. So think for your organization, what level of engagement do you imagine? Is it a low engagement with modest improvements in demand and selected projects? Is it a medium level of engagement where the collaborative helps to make significant improvements in demand? Or is it a high level of engagement? Would your organization, you might automatically default to say, of course, we want a high engagement, but what would that mean for your organization? That's what we invite you to think about and consider. So a little bit finally about how the consultation today is going to work. First of all, let's be clear. The reason we're convening this is because your insights matter and we value your experience and ideas. The process, we're going to show some questions on screen. I'm also going to share them in the chat right now. Here's the first set. And again, these are questions not about you as an individual. We know if you're here today, you like the collaborative, but that's not what this is about. This is about your organization, and even if you are here in a personal capacity, we want you to think about, to the best of your ability, respond to these questions. Now, write your answer in the chat, preferentially. Raise your hand if you wish to speak. Make sure you have good connectivity if you raise your hand. We suggest you write first and speak once you are called on after raising your hand. Now, your insights, what you share today, will be shared with our partners, NPHCDA, UNICEF, and others. And we really need your help to help us align the collaborative with what you need, what is going to help you most make a difference for immunization outcomes where you work. And we have the shared conviction that together we can, in fact, work together to improve immunization outcomes. I see Jamil Hassan Abdul Karim, who has a hand raised. Please go ahead, Jamil Hassan. I'm going to, okay. And actually, Jamil Hassan is not connected to the audio. So let's dive in now with the questions. And the first set of questions, as you can see, is your organization's participation in the collaborative. So we'd like to know is, has your organization formally endorsed the collaborative? Please raise your hand if you'd like to be the first to answer this question. And what level of engagement does your organization wish to have in the collaborative? So I'm going to, let's see. We're going to go to Teresa Osunde, Shola Babadia, Mubarak Musa Hashim, and you know everything we do is fully collaborative. Okay, I see Ayuluwa Adekoya. Please go ahead.
Okay. Good evening, everybody. I believe we can hear me.
Loud and clear.
Thank you so much for the opportunity. Thank you so much for the opportunity to have this collaborative to improve immunization for children in Nigeria. I'm Mayuwa Dekoya. I'm representing Fragrance Stars Foundation, an organization that is involved in building leaders out of youngsters, especially through health and other aspects involving community adults. My organization has been formally endorsed to be part of this collaborative. And the level of engagement my organization would want to have with this collaborative would be a high level involvement. Thank you. We are based in Ubumosho, Southwest Nigeria. Thank you.
Okay, thank you very, very much. Ayulua, we had questions. So yes, so that's wonderful to know that you want that high level engagement. Let's go to Mubarak Musa. Please go ahead, Mubarak Musa.
Good evening, everyone. My name is Mubarak Musa from Kano. My organization was already engaged into these programs. That is UNICEF. And the level of engagement was at low level. That is, at the low level. Thank you, everyone.
All right, thank you, Mubarak Musa. And let's go to the next question then. Who in Kano State from UNICEF participated in the RCA exercise, and how did UNICEF in Kano support staff or colleagues who participated? All right, go ahead, Ayulua, if you'd like to answer that. Ayulua Adekoya.
Okay, thank you so much. The RCA exercise from my organization was done by me, and my organization supported me by helping to come together, to put our minds together, to look at our community. What are the challenges of immunization that children are having in my community? So we're able to put heads together to be able to do a root cause analysis exercise, which I led as the executive director of the organization. Thank you.
Okay, thank you very much indeed. All right, we have many hands raised. We're going to try to hear as many voices as we can, but I'm also going to share that after this meeting, you'll be receiving a link so that you can make a written contribution on behalf of your organization answering any or all of these questions. So let's go to Fatima Husseini. Fatima Husseini, yes, please go ahead. So the questions,
okay.
Yes, please do introduce yourself.
Yep. Okay, my name is Fatima Husseini. I'm the founder of Hajafanna Supportive and Development Initiative. Thank you for giving me this great opportunity to be part of this journey of sacrifice. During root cause analysis, I'm not the only one that have done it, because already in all the local government, I have representative, and my organization specializes in research. So I shared all the information that I need, and they were able to get it, and we analyzed it. That is why I created my root cause analysis. And
okay, thank you.
We are not supporting them already. They are doing it willingly. So we have been doing it willingly. I have never been supporting them with anything unless words of encouragement. Thank you.
Great. And could you tell us something that you learned from the collaborative that can help your organization?
Okay. Something that I will learn from collaborative that can help my organizations are many. Because already in the organization, we have been supporting children that are sick, that have been battling with vaccine preventable disease. If to say we have been collaborated and we were able to given the opportunity to sustain them, and caregivers maybe accepted vaccines willingly, maybe that money that we are spending on children, we use it for another things. Then secondly, for collaborative, there is many issues surrounded, especially political interests and many things. But if we have been collaborating with the National Primary Healthcare, UNICEF, and other NGOs that are supporting this event, I think it will be of good help for them to have insight on how to tackle so many issues. And then they will look at our data and look at their own data and make a comparative analysis on how they are implementing their activities. That will give them great insight, because so many things has been hidden from them. I'm in the system, I know everything. Thank you, and over.
Thank you very much. One last question for you, Fatima Husseini. And again, for those of you who didn't get, we have shared all the questions in the chat. So do speak to the ones that seem most important to you. Fatima Husseini, next and final question for you is, how can the collaborative help improve coordination where you work in your area between government, community, and private sector?
Okay. I think there's this issue already, everybody with NGO, I was known as a humanitarian. I have never engaged myself with this immunization and other things. Rather, I used to invite them because I used to advise them because I'm in the system. So if to say there is collaborating, it will improve coordination between my organization and Primary Healthcare Development Agency, that's government. And then secondly, the partners that are hosting such activities also, because there was a time when I'm working with WHO, I have 168 youth graduates, which I named them as community volunteers, state volunteers. And I was able to introduce them to WHO, and they are doing a perfect job almost across their local government. Only that they are not being supported for anything. You don't expect them to go for a supervision, you don't expect them to do this and that, and then at the local government they are not involved in them. So I think if there is this collaboration, it's going to be a perfect collaboration between the organizations and government organizations and other NGOs that are hosting vaccination. Secondly, we are known to the community. And then thirdly, we are not saying that we are not looking for something to sustain ourselves, but we look at communities first. Our interests will put communities first, then our interest becomes second. So I think if there is collaboration between the government and other NGOs, definitely the outcome will be positive and there will be a good outcome of immunization. And then lastly, as someone who knows many things related to immunization challenges across the state, and I was given the opportunity, I think it is God willing that give me this opportunity whenever I speak with a woman. I believe in behavioral change, not giving an incentive. Because I'm not bragging. Almost all the communication officers that are attached to government and other agencies, they are just saying go and take vaccination. And there are some other agencies also that are even giving incentive. Maybe if you take your child for immunization, they will give you something amount of money. But if I change your behavior, willingly accept the immunization, not the content of the immunization, why are we immunizing our children?
Thank you, Fatima Husseini.
Definitely will achieve everything. Thank you, and over. Sorry.
Thank you very much indeed. Okay, we have many hands raised. As I said, we'll be sharing a link so that you can submit your written contribution if you're not able to speak today. So, and again, for those of you who participated in the root cause analysis exercise but have joined this session late, you are going to receive the invitation for the commencement event. This is the formal ceremony where we will be awarding certification to everyone who has successfully completed and met the certification requirements. Just because we have not communicated on this, we do not want anyone to be left behind. I take note of the many introductions and messages in the chat as well as their quality. Let me see. We're going to go to Esther Yakubu. Esther Yakubu, please go ahead. I'm asking you to unmute, and then Teresa Osunde as well. Teresa Osunde. Okay, go ahead, Esther, and then we'll hear from Teresa afterwards.
Okay. Good evening, everyone. I'm Esther Yusuf Yakubu, working with Health and Development Support Program based in Jos Plateau State, Nigeria. Well, based on the first question, how can your organization integrate collaborative approaches into the existing work? Well, as hands, we work with other professionals in all the field and in the community, and to also address goals and challenges that might grant us a success towards whatever we intend to do. And based on communication, we have so many clients, colleagues, and stakeholders in which we relate with in order to have a very reliable implementation when it comes to immunization. We create innovative ideas and also to see how we can really relate with other partners in other organizations to the success of the immunization in our targeted areas. We empowered people also to ensure that, okay, in our absence, the work will not slow down, but rather it will keep going with the people we are empowering. Just the way like one of the participants speaks about community volunteers. So in our own terms, we have already an existing structure. We call them CDDs. And these people, we can use them to integrate with other activity to deliver the immunization. And one thing we normally do as an organization, we are so inclusive in everything we do. So whatever we do, we make sure that persons with disability, female or male, we try to inculcate them in our activity for better outreach, not minding what stage the person is. All we want to do is to ensure that the immunization gets to everyone. Thank you, and over.
Thank you, Esther Yakubu. A question for you then. How does your organization already work with government in where you are in Plateau State? And how can the collaborative help improve this? Sorry, apologies for the spelling mistake.
It's okay. Yes, my organization, we collaborate with the State Ministry of Health. And from the State Ministry of Health, we ensure that we get to the local government and to the community. We don't just work on our own. We have an existing structure that enables us to really collaborate with the health sector of that very state. And this makes our work more acceptable and easier in the society where the office is being situated. Thank you.
So that's wonderful to hear, but do you see the collaborative helping this? Because the collaborative is new, maybe you don't need something like the collaborative. How is it, how can it help you? And if so, how?
Sorry, please come again with the question.
So in the relationships, you already work closely with government, if I understand correctly. Now this new thing comes along, the collaborative. Do you think it can help you work better with government, or is it something that doesn't really make a difference there?
No, since we have built a very cordial and existing relationship with them, and we are being so transparent in whatever we do, whenever something new comes, accepting it is not that difficult. Why? Because they have been accepting other activities that we introduce into the community, which has been helpful to them. So bringing something new, I don't think it's going to be a very hard thing for acceptability. Thank you.
Okay. Thank you very much, Esther. And now over to Teresa Osunde. Teresa, please go ahead and you can please speak to the questions that are most important for you. Really, this is your opportunity to make your voice heard on behalf of your organization, for your thoughts about the collaborative and the way forward.
Good evening, everyone. I'm Teresa Osunde from Edo State, an employer and a member of primary healthcare agency. Our main aim of collaborative is that we make sure immunization is very important. We make immunization compulsory, that we have a aim that no child should die from any illness that immunization can prevent. That's our aim. And not to just start it now, we are going for outreach, because if you discover those people living in the urban areas they easily bring their children to immunization at our health centers. Those are in the interior village, they don't come. So we go to outreach in those interior villages. We go and meet them, we pet them, we guide them, we advise them the importance of immunization. We even tell them that whenever you have anything, some of them, we will encourage them by giving them finances so that they don't have money, they don't have transport to come to the health center where they can be vaccinated. We just say, okay, we are here with the vaccine. We vaccinate their child, we record everything, we have their contact, we take their phone numbers. So whenever they need the next appointment, we go back to them to immunize them, because we now discover that if you are looking for zero dose, zero baby, zero dose for children that are not immunized, you see them in the interiors, not in the rural areas. That's why we now channel our outreach to the interior villages. Even some of these villages, you can't even get there with it. There's no road network. We have to trek with our vaccine rush. We go and meet them in their houses. We'll be encouraging them. If vaccine is very important for your babies, we tell them that if you immunize these children, the immune system of the child will build up. They will accept it. We immunize them. So they will go to schools, because if you find out something, there is last OBR we did in my state. Some proprietors refused. Proprietors of schools refused. So we go to the proprietors, we'll have meetings with them, we'll advise them. If any child is immunized, paraventure a child that have meetings, you allow that child to go to school. Before the day runs out, or up to about 5 children will be infected. So when I advise them, when the child is not immunized, is exposed to other children. So that's why we have meetings with the proprietors of schools. We encourage them the importance of immunization. They will abide with it. They will accept us. We said, okay, from henceforth, whenever we are giving immunization, we'll send their letters to inform their parents, so that they will accept this immunization. And each of these community that we visit, we have a spokesman. We liaise with that spokesman. What is the name of that spokesman? Whenever there's a pregnant, a woman that just give birth, that have not been immunized, this spokesman will contact us. We'll take our vaccine, BCG, and other. We go and meet the woman in that interior. We immunize the child. We want to make sure no child is left without being vaccinated. That is our aim. Thank you.
Thank you, Teresa. So just a question, how does this connect to the collaborative? Was this the focus of your root cause analysis, or is it something else?
It's among this, because our immunization is the main focus of that. We should collaborate and make sure immunization is given to every child. That's our aim. I believe collaborating with us, it will be easier for us to carry out this thing effectively.
All right. Thank you very much indeed. All right. So I'd like to ask you again to focus on the perspective of your organization, even if you are here in a personal capacity. That was a question we asked you, so we will be able to, we understand that, but we're still interested on your thoughts in a personal capacity about what the collaborative might mean for your organization. Has it been helpful or not? What do you need in order for that to make a difference? We've shared the questions in the chat several times now. I'd like to go to Loria Yusuf, Kayode James, and Abdusalam Suleiman. Let's see who will unmute first. Do raise your hand. We have many hands raised. We're obviously not going to get to hear from everyone. So please, if you do not get to speak today, we'll be sharing a link right after this this session so that you can submit your written comments on behalf of your organization. Abdusalam Suleiman, a warm welcome to you. Please do introduce yourself and tell us on these 3 questions, your organization's participation in the collaborative, the value of the collaborative for your organization, and then the integration of the collaborative into existing mechanisms. What would you like to share across one or more of these areas?
First of all, hello everyone. My name is Comrade Abdusalam Haruna Suleiman. I am Director of Network for Youth Enlightenment and Development, NYED organization based in Kano State. First of all, I want to thank you for giving me this opportunity, or for giving my organization this opportunity to participate in the routine root cause analysis. It is really wonderful and good opportunity for us to learn more about this immunization. My organization was participated actively in this immunization exercise, so that although we have already have some knowledge about this immunization, because some years back we have we are partner with a national hospital that we have in Gandung Albasa, that is in our area. So we are volunteering into the immunization activities, so that we have already have that little knowledge about the immunization. So when we come to this exercise, so we conducted a lot of data collection, where we approach our local community areas in Kumbusa local government. In one town we call Batakai local government. So we got some data that indicated a lot of children have no, or they have zero dose immunization, because we use some mechanisms to get that data, where where we went home. How should I put it? Uh, we went to the community in Bataka local government, where
Sorry,
we
Abdul Salam,
communicated
just a
with.
clarification question. Did you do this data collection and going to the community during the collaborative? Because the collaborative was a very short period of 2 weeks.
Yes.
Okay, so you did this during the collaborative activities.
Yes.
Okay.
Yes, sir.
Okay, that's remarkable. Please proceed. Yeah, and conclude, because we have many others who have their hands raised. If you can really be concise in telling your story. Thank you.
Okay. Thank you, sir. In brief, we learn a lot of knowledge about this immunization, and so also we have done a lot about this immunization. It is a great opportunity for our organization to participate in this exercise, and we are ready to participate more in the future by the God willing.
Thank you very much indeed, Abdul Salam Suleiman. Okay, I want to go now to Kayode James. Please go ahead.
Good afternoon, everyone. My name is Kayode James. I'm speaking for Briskila MFSC Women Foundation. I'm the program manager here in Bauchi State, Nigeria. The root cause analysis process in our organization was a great one, in which we enjoyed it. My organization actively participated in the root cause analysis. The executive director, inclusive the M&E officers and other staff within the organization, came together, put heads together to ascertain the root cause analysis of immunization in the state. And you see, the organization itself has some roots and bases in some local governments. So within that period of time, we're able to source for information from those areas, and we came out with a robust and effective root cause analysis of immunization. And as a matter of fact, we are ready to partner at a higher level than we are now, because it's an advantage on our own side to have learned a lot of these within the period of time, and especially the time where we are now. Thank you for the opportunity to be a part. We really appreciate it.
Thank you very much indeed, Kayode James, and we hear your response about the level of engagement. I also want to acknowledge the great quality of the comments in the chat and the specific responses to the questions. For example, Ayuluwa Adekoya, who we heard earlier, spelled out both the specific benefits and explained how the RCA method could could contribute to strengthening the micro-planning process. That's very helpful. If others would like to contribute in writing, because it is obvious, given the number of hands raised, that most of you will not be able to contribute to speak, but we appreciate the written contributions in the chat. We do save and review them, and of course we'll be sharing a link so that you you can respond to these questions in writing on behalf of your organization if you're authorized to do so, or otherwise as an individual. So very much appreciating. Okay, and I see we still have some Otter.ai robots in our room. So let's go to, let me see who we have. So we have Shola Babadia, who had, okay, and then Sabatu Elizabeth Denladi. Sabatu Elizabeth Denladi, please go ahead.
Okay. Hello.
Yes, we hear you clearly, but not very loud. So if you can speak very loud and close to your microphone, please.
Okay, can you hear me now?
Yes.
Can you hear me?
Yes, indeed. Loud and clear.
Yes, ma.
All right. Yes, I want to share, yes, after the RCA, I am Sabatu Elizabeth Aladi. I participated in RCA. And I'm among the partners. I work with the African Hope for Community Progress Initiative in Nigeria. I am the CEO. Already, AfriHope is working with the UNICEF Bauchi DP office in area of addressing the zero dose children. I found this my peers. I used some of the ideas from the peer learning. Ago, I discussed with the UNICEF communication specialist about the plan, and he is willing to receive my proposal for us to start implementing across 13 LGS with zero dose in Bauchi State. So we are going to share with the House. By the time the proposal scaled through, we start implementation, we are going to share the lessons learned and the success stories. Thank you.
Thank you very much indeed, Sabatu Elizabeth and Ladi. As you know, UNICEF is our partner together with NPHCDA, so it is good to hear that in Bauchi State they are already recognizing and potentially supporting your important work that you and your organization are doing. We hope to hear many similar stories. We also invite you to think about what the potential might be beyond that support to specific projects. So, Shola Babadia, I think you were actually one of the first to have your hand raised, so I'm coming back to you. Unfortunately, there's no easy way for us to tell the order in which hands are raised, which could provide a fairer way to select contributors. Shola Babadia, please go ahead.
All right. Good evening, everyone. Can you hear me?
Loud and clear.
All right. Thank you very much for this opportunity to learn. I'm speaking for Citizens Health Development, Citizens Health Education and Development Initiative based here in Abuja. With regards to, okay, we participated in the RCA. The focus of our RCA was to reduce rejection of immunization in Gwarimpa community in Abuja. Of course, and then also see how we can use the experience when we have implemented our strategies, and see how we can share it with the health board and by extension the Ministry of Health to share the lessons learned and the strategies, and see how there will be an uptake of immunization in Abuja. The exercise was very interesting. We collaborated with the FCT Health Board, where we collected vital information and data with which we used to fill out information in the RCA. Of course, after the RCA and has been approved by the collaborative, we took it back to them and shared with them, and the strategies that have been laid out. I must mention that one of the things we took away from that exercise was that we were able to, the whole exercise helped us to articulate our strategies, step by steps, um, to be taken to ensure that our goals are met, especially the vital questions to be asked to get to the main root question, main root cause of the problem we're trying to address. So that helped us a lot, and we would articulate actions and strategies. And we got back to the government, shared with them. They have given us their feedback and saying that our strategies are good, and it will be feeding into the next plan, the future exercises, immunization intervention in Guarimpa community. We've been monitoring that closely, although we are doing our part in, of course, creating demand within the community for immunization. And we'll be working with the government, with the FCT board in their future planning in implementing immunization activities in Guarimpa community. So in all, it's been helpful. And about how the collaborative will help us, will help increase participation in the government. Yes, it will, because you know, the fact remains that most government organizations in Nigeria think every NGO has money, every non-governmental organization has money, and whenever you come around, you are bringing money to the board. I mean, to the table. So the collaborative will help, smoothing relationship between organization NGOs with the government, and create that smooth communication between us, and in terms of idea sharing, especially where you have not been able, organizations have not been able to gain access to, like top hierarchies of government, especially at the federal level, where your ideas would have made some difference. But of course, you are not able to get to those places and then point certain issues to people that are in power, because you know that they are the ones who will be able to address those issues, but you are not able to reach them. So the collaborative will be able, to amplify the voices of communities, especially those working, CBOs or NGOs, especially those working at the community level. It had to reach areas where we record zero doses of immunization. So I think the collaborative will help us amplify voices and these ideas to get to the people that really matter, that can, that have the wherewithal to solve these issues of rejection at the community level. So far, so good. The collaborative has been very, very helpful, and we hope to continue. It's highly endorsed in my community, and it has really helped our work so far. Thank you very much.
Thank you very much indeed, Shola Babadia. So a lot of your comments, as well as those of colleagues, would raise more questions. But in order to ensure that as many of you are able to speak in this meeting, we're going to go to the next person, and I believe that is Al-Qasim Shafiu Al-Qasim. So please, and there is no way to ensure geographic equity, because we cannot tell from your names alone which state or region you are from. Al-Qasim Shafiu Al-Qasim, please go ahead.
Okay. Hello.
Yes.
My name is Al-Qasim Shafiu Al-Qasim.
Yes.
And also, I am based in Kano State. And although we are very happy for this collaboration and this partnership, because that's what we are seeking for.
Sorry, what is your organization's name?
My organization name is Youth Activist and Mobilization Forum YONFO. And although I would like to take this topic to based on like exploring partnership opportunities with other members and organizations,
Can you tell us how you're involved with immunization?
Yes, like how we involve in immunization is like there were several times we used to involve with immunization. Like if I could remember, there's a one time we work with UNICEF as like their members, VCM voluntary mobilization community. We work with them through like if I can remember, it's one of the immunization, I forgot his name, is like diphtheria. We work in diphtheria immunization, and also we achieve many things on it. Maybe awareness. That's all we are. Like, we are mobilizing and awareing the importance of immunization in our society. Due to the situation we have lack of awareness in our community. That's why we raise up on this campaign, and we are willing to accept this as one of our best project ever. And by the grace of Almighty Allah, we are going to work on it hand on hand. And although we have a lot of members down in our organizations, and apart from that, we will collaborate with other members. Youth activists and mobilization forum is eager to explore partnership opportunities with other members and organizations to amplify our impact on immunization effort. We believe that collaboration and partnership are essential to achieving this immunization agenda. We have potentials partnership opportunity we'd like to explore. That was including joint advocacy campaign and cohorting event and training seasoning, and although resourcing sharing and expertise exchange, and we can although community outreach and engagement. That's our main targeting. The research and data sharing. That's all specific organization we'd like to partner with in we'd like to partner with this movement, because I have already talked with my members. They give me assurance 100%, and that's all about. We really appreciate.
2 questions for you, Al-Qasim, Shafiu Al-Qasim. How many members does YANFO have? And how many LGAs do you have a presence in, where you have a significant number of members?
Okay, let's summarize, because right now we are on collecting new members. But the main active members we have right now, we have more than 630 members. 630 members. We have more than that. Because I am the PRO of I am the public relation officer of the organization. Although I am the one who is to handle I am the data collector of the organization, because I am data analyst. I'm the data collector. That's what I'm working out daily to verify the active members. But our local government, the main, how can I explain it to you? The local government that our members are living in, we have more than 27 local governments.
Yep.
Which include the metropolitan the metropolitan of the state. We have more than 27 local government, and although daily we are working on to expand it and share it to all the rural areas to accept the membership of these organizations. And that's all about.
All right. Thank you, Al-Qasim, Shafiu Al-Qasim. All right, we'll go next. Let's see. We don't have very much time left. We have just 9 minutes, and we are very strict about punctuality. Let's go to, let me see. So we had Loria Yusuf, and then we have also, we'd love to hear people we've never heard before on behalf of their organizations and the organizations that they represent. Please, Loria Yusuf, please go ahead.
All right. Good afternoon. Thank you so much for having us. My name is Loria Yusuf. I'm speaking on behalf and in capacity for Pearls and Wellbeing Foundation. So yes, our organization has been formally endorsed, and of course, basically our organization works across the 23 LGAs of Sokoto State. We are a part of the LERIC and the SERIC, which is the state and local government immunization, routine immunization committees. Of course, we are very strong in working with the health education units, where we do all of the what do you call it? What we do all of the campaigns, and we sensitize the community and helping them understand the advantages to ensure that the children are immunized, but most concern right now is around the zero dose LGAs, which are quite high. Zero dose LGAs are 13 zero dose LGAs, and we are having real time issues with non-compliance. And so, of course, we have been developing lots of committees which involves civil society organization, and we have a couple of technical working groups. We are also building and doing some sort of system strengthening within the communities, and we are working with the religious and traditional leaders to ensure, right, that all of these communities where we have the zero dose issues are combed, and all the children are fully immunized. So we have very high concern for the security what do you call it, the security concern LG. So we have very high insecure locations, and these locations, of course, banditry and all of the kidnappings have been quite difficult for us to be able to access some of these LGs. But of course, we have very strong government support that gives us all the security cover to be able to see how we can do all of those remote monitoring, especially to ensure that the children in some of these LGs are fully immunized. So of course, this collaborative is going to be very supportive. We work very strongly with government in the state and at the LG levels, but we are very happy to be part of this collaborative because we also have a technical working group that involves UNICEF, WHO, Clinton Health Access Initiatives, and other partners, Bill and Melinda Gates Foundation. They are all supporting and funding immunization activities in the state. So this collaboration will help to, continue building our capacities, sharing experiences from other partners who are doing the same thing as us. Yes, so just like I'm saying that the collaborative can help to improve coordination between government, community, and private sector. Yes, it's very important for us. We are not having a hard time, but we are growing into helping the state to coordinate the sector. Coordination is quite difficult here, but of course we are looking at how we can capacity building on how to ensure that we strengthen this, our coordination between the government and the private sector and the communities themselves. So if we have all of that, and then of course, like the data unit, especially in the states, right, the M&Es need lots and lots of capacity building to ensure that they are able to ensure that data is adequately taken care of, and then integration of the collaborative into existing activities and mechanisms.
Yes, for example, Maduaka Uche, you mentioned that you already have a working group with many of the immunization partners. Would you envision, would you be willing to invite a member of the collaborative to represent the collaborative in this working group? Would you be able to propose such a thing, or is that who could decide that the collaborative is legitimate to have a seat at the table of these working groups and other networks?
Okay, great. So at the helm of affairs, like the leading government agencies who are taking the lead in all of this is the Ministry of Health and the State Primary Healthcare Development Agency. So we have the Commissioner of Health, and then we also have the Executive Secretary of the State Primary Healthcare Development Agency. So, of course, they are very happy to sit with us and then listen to us, and they will be able to also ensure that we have a representative, if it's from the government or from the partners who are also implementing. And I'm very sure that we will be able to have them, be fully represented in this collaborative.
Wonderful, thank you. I'm going to lower all the hands, and if you feel that what you have to say is sufficiently important for you to be the last speaker, then please raise your hand. And the first one to do so is Yakubu Mohammed. So Yakubu Mohammed, the floor is yours. You'll be our last speaker. As I said, we will be sharing a link so that every organization represented today is able to share a written submission, your input into this consultative process. There will be, however, a very short deadline because tomorrow we have 2 meetings, one with an important Nigeria country partner and the second with UNICEF and NPHCDA. We will be setting the deadline for you to share your inputs to Tuesday at noon West Africa time. So we'll be sharing that in the follow-up email. So you do have an opportunity to submit your written feedback and responses to the consultation questions. There is a very short timeline, and I've told you the reason. So let's see, Yakubu Mohammed, please go ahead. Asking Yakubu Mohammed to unmute. Otherwise, we have Kingsley Inang, who's also raised a quick hand, and Rashida Musa Mukadas. So please.
Could I speak?
Yes, please, Maduako. Is that? Yes, go ahead.
Okay, my name is Chinedu. Apparently, from Hardback Cares for Better Health. What we want to do is that we believe that when the Mpox vaccines are available, we want to take part in the rollout of it. And we know that the producers, Nordic Vaccines, it's a company that is in Denmark. They are the producers of the Mpox vaccines, and they made some donations to the Africa CDC. The easiest way to form defense against infectious diseases through vaccination. So we are hopeful that when the rollout for that is available, it would be integrated, and also the cervical vaccine rollout. We want to carry out exercises in Enugu in partnership with the government. The government of Enugu knows us. The government of Abia State knows us. We work with mainly the local government chairman through the Association for Local Government, that's ALGON. So, and we believe that we can actually be part of what the National Primary Healthcare Development Agency is doing and other global implementers are doing in the area of vaccinations.
My last question, the question would be then, do you see, for example, with respect to the efforts that the national authorities working with partners are going to organize for Mpox vaccination, do you see you are advocating, of course, for a role for your own organization, but do you believe that this collaborative, this network, platform, and community of organizations and individuals could help and could be in this effort and would actually strengthen the case for your organization and others to be involved in Mpox vaccination? Do you agree or disagree, and for what reason?
I totally agree because the cases are increasing in the Democratic Republic of Congo, and in this era whereby the world has no borders, Enugu State has a priority because Enugu State has an international airport that has a lot of flights from Ethiopia, and Ethiopia is a hub for aviation. So since international travelers are moving across Africa, some of them might come to Enugu, so there might be a need to have stockpiles of vaccines close to the airport, and maybe ensure that people who are traveling have Mpox vaccination before they leave. But what we're actually anticipating is for the rollout of the Mpox vaccine, because in the past there were just only about 200,000 doses, which were not enough, but global partners have actually made donations in that regard, and we're actually expecting such donations to come close home so that people will get vaccinated.
Great. Thank you very much indeed. Again, you'll also all be receiving a link right after this call, or within an hour after this call. I realize it's evening, and with a very short deadline so that we can get your inputs in time for 2 of the following debriefings that we'll be doing with close partners, including UNICEF and NPHCDA. Once again, thank you and goodbye.
Bye. Thank you for the opportunity. Thank you so much.